Good morning, everyone. It is about 9:30. My name is Grace Bissonette, and I am here with Danielle Palmer. We're going to be doing the Care Navigator monthly user group call. Welcome to all of you. There is a Q&A that you can insert any questions as we go through the demonstration. If you would like us to review a different topic, we save that usually for the end. And if there are questions about what's currently on the screen, we try to embed those in throughout the presentation. So feel free to put any questions you have there. I'm going to jump right into the agenda. So today we will be doing some system demos that will include searching inactive patients, how to add care team members and non-ACO members, reactivating inactive care team members, bulk add users to patient care teams, searching active and inactive care users, Care Navigator users, and then a couple of reminders and tips. And a thank you to many of you sent us some questions to cover today, and we appreciate that. It's always, we use this hour for what you guys need, and so thanks for sending in the feedback. Danielle's going to go through and start with the system demos. And Danielle, you are muted, and I am unable to unmute you, just as a reminder.
Great. Can you hear me now?
Yes, I can.
Great. Okay, wonderful. Good morning. I'm Danielle Palmer, and I'm going to take you through some demonstrations. Just let me know if you can't hear me or you need me to slow down or show something again. The first one I was going to show today is how to search inactive patients. So I've logged into our staging system here at in Care Navigator. Searching inactive patients, we use this once in a while for people who are looking for an active patient and they can't seem to find them. So I like to tell people they can look in the inactive patient list. These folks you can't reactivate or start case managing, but it just gives you an idea that they have fallen to this list. And that's determined by our payer programs, who's eligible. So to find this, you go to patients, and it auto defaults to active patients here, but you'll click on this little drop down and you click inactive patients. And of course, these are my test people. The search bar doesn't function for the inactive patients, so you can either use the alpha here at the bottom, or I find it easiest to turn your filter on and you can search by last name, first name. So I'm gonna look for, I'm gonna do a custom filter for my patient. Her name is Apple Logan. So I'm gonna do, you can do equals or contains. Logan. And then it brought up Apple Logan. So this is how you would search inactive patients. And then I wanted to just go a little bit further. If you can click into their record, which I'll do here in a second.
And as that loads, just a reminder for folks, we are in a staging system, so all of the patient information is patients that we've created. There's no PHI, and the staging system does operate like in production, like how you guys would see the system, but there are updates that occur periodically. So there are some views that might seem slightly different. And the system does load a little bit slower when we're sharing through Teams, and I'd like to just remind people of that.
Okay, so here I'm in an inactive view. You can see right here it says inactive, and it's in read only. So that's just a reminder that you can't work on these inactive patients. Okay, so I'm just going to go home.
And Danielle, I guess we're getting some questions on sound. And if folks can you confirm? It looks like people are saying it's better. Are you hearing us okay?
I can speak up probably. That might help.
I think someone was saying it was a little choppy.
Okay.
It sounds clear on my end, Danielle, and I'm not seeing anyone say anything more. So hopefully you guys can hear us. I'll put a update in the Q&A as well.
Okay.
And Danielle, we did have a question. Can we run a list of inactive patients or only search one person at a time?
So let me just go back. You might be able to export the list. Let me just take a look.
It looks like our audio is good. So thank you folks
great.
for letting us know.
Awesome. So it does have the same functionality as the active patients, so you can export this to Excel. You just do a static worksheet and hit export, and it will open up all of the inactive patients, and then you can sort from there, which I find to be an easy way to do this. And then you can, excuse me, you can break down your list. However, you can filter from your Excel list.
Thanks, Danielle.
Okay,
that's the only question so far.
Okay. The next demonstration is how to add yourself to a care team. So I'm going to go to patients. I'm going to switch this back to active. I'm just going to use my test patient, Gail Matthews. Okay. So to add yourself to a care team, you go to the care coordination section, and then you'll want to scroll down to current care team. You can see here there's 10 people on the team right now. To add yourself, you'll click on the grid, and then you'll do add care team member. I'm just going to add myself, so I'm going to search my name. I'm just going to put my last name. And then you pick your role. And this is a care team member. And if I wanted to add myself as lead here, this is where I would go ahead and check that box and then give a reason for adding myself as the lead. And then you just hit save and close. And then you'll see you've been added to the care team. There I am right there. Now, if you want to add a non-ACO care team member, I'm just going to go back out so I can show you the steps from the beginning. So again, you click on care coordination, go to the current care team, click in the grid. Okay, and then add care team member. And here you'll enter the person you're adding. Again, they're not a Care Navigator user, so you're not going to find them when you type the name in, but this is how we would add them. So my person I'm going to add her name is Apple Davis. So you're not going to find it again, but oh, well, I did because I'm going to do someone else because I'd already added her. Kate Lambert. Okay, this is where you would look up more records. Okay, and then you click New. All right, and you can see the asterisk here is really the only required field is a last name, but we just tell people to enter as much information as you do know. So I'm going to put her name in. Lambert, and she is a school nurse. And you can see that it says non-ACO with a checkbox. It's fairly light on my end, but she has a licensure. She's an LPN. And then I have a phone number for her. Okay. And then you would just hit save and close. Oh, sorry, it's right here. I gotta put, oh, there it goes. You have to put the full name in. I didn't see that there, but it just auto-populated that in there. So now you can hit save and close. And then select add. And then here you'll pick the role, which she's a school nurse, so I'm gonna have to look up more records. And then you can scroll through, or you can type it in there, but I'm gonna place a check mark, hit add, and then we'll do save and close. And let's see, she is right here. Kate Lambert, school nurse, participation type is non-ACO. And we do have a module on this one because it is a lot of steps on our website. So the steps are written right out for you. And we also have it in our PowerPoint today.
Thanks, Danielle. I have a couple of questions.
Sure.
The first of which I'll answer. We had a couple folks ask, in what case, with regards to inactive patients, why would someone become inactive? How do they become inactive? And that is purely, so annually for each payer. So for Medicare, we currently have the 2021 population that attribution has been completed on. And so we do leave a little bit of a buffer from the previous year to allow for individuals to continue to document or have access to their records within Care Navigator. But someone becomes inactive if their insurance changes and they switch payers. There's quite a few reasons, but predominantly it's they've switched payers, their attribution has changed. For Medicaid, the payers sometimes change within the same year. And so someone inactive would be typically they've fallen off of attribution or they're no longer attributed to the ACO. And so we do leave a buffer time to allow for folks to still see those inactive patients so that it isn't just there one day and gone the other. But for example, when we did the Medicare 2021 population back in, I think it was January or February, where we had that new population, we left a little bit of a buffer and then we removed the no longer attributed patients out of Care Navigator for, data integrity. Hopefully that answers the questions for folks. I had a couple more. Let me just see here. So along the same vein, how frequently are lists updated for that attribution? That's done once a year. And it doesn't change mid-year for patients. They can't, if you're attributed at the start of the year, you're attributed throughout the year. If and so that'll show in Care Navigator. So that's something that practices can depend on the initial alignment lists remaining the same for the full year. And the only caveat is that each payer provides OneCare with the necessary data at different timeframes. So we have Medicare within Care Navigator right now, Medicare data for 2021. We will be getting Medicaid, and many of you will be getting a notification in the next week or so. We will be getting Medicaid's data by the end of this month, and it will be in Care Navigator for 2021 at the start of May. And then our commercial payers, they come in at different times. And so we do try to communicate out broadly across the network when we anticipate that data to come in, so that folks are aware and can be monitoring that in Care Navigator. And we do send a notification to all active Care Navigator users so that you guys are aware when we get new payer data. So I think that answered that one. Let me just see here. Sorry, Danielle, I got a couple more.
No problem.
The buffer is usually a month for whomever asked that. That we wait. We try not to keep it past that, because if we have a new population within the system, we do not want, sometimes the new population will have the same individuals attributed because their insurance hasn't changed. And so they'll have their new record in there in the system, and we don't want to have overlap. And then we had a couple of questions. I think I got through the ones with regards to data. We had a couple of questions about what you were just speaking to, Danielle, the first of which, if you want to make yourself the lead after you are a part of the team, unsure of how to edit it.
Sure, I can show you. So I can use myself here as an example. I had just added myself. So let me just go back out in case, so I can show you from the main screen. So if you want to go in and now add yourself as the lead, so you'd still go back to care coordination, go to the current care team and click on the grid. You need to click in your record or whomever you want to add as the lead. So I'm going to add myself. So I'm going to click in the blue here, this space, and it'll bring up this box. And then you just check mark on the lead CC. And then I'm going to put just a staffing change, and then you hit save and close. Okay, and then you can see here it says lead CC yes, and then for it to appear in the orange header area right here, I just refresh my screen, which my refresh button's over here. And there it is.
Thank you.
Welcome.
I've got one more, and I think I can answer this one too. What would examples be for adding non-ACO care team members? And so this individual, you've got it right. You said legal guardian or school contact. This was a field that we added from feedback from you guys from the field with regards to individuals that weren't working for an organization within the OneCare network, but still had a significant impact on the care or participating in the care of a patient that's attributed. And so this could be a school nurse, it could be a school contact, it could be, I think one of the more recent examples was someone a home health provider that's private pay, that doesn't work for an organization, but interacts with the patient for an extended period of time each day. And so has a meaningful relationship and should be included in the care team. And so we wanted to be able to have that add ability to accurately document all the individuals on a care team for a patient, not just those associated with the ACO. I think I'm caught up for the time being, Danielle.
Okay. The next next thing I was going to show is how to reactivate an inactive care team member. So it's still in the same care coordination section. Let's get back down to my current care team. What I'll do to demonstrate is I'm just going to remove myself, so I'll be showing you how to remove yourself too at the same time. So to remove yourself, you would place a check mark in front of your name and you hit deactivate. You wouldn't want to delete, you would just want to deactivate. And then I'm just going to put staffing change. And then it does send a message via email to let the person know that they've been removed from the care team. And if I wanted to add myself back, or this is where you would go to add anyone back that was currently on the care team. On this drop down, you change it over to inactive connection associated view. And you can see that's where I landed when I deactivated myself. So now I want to put myself back on the care team. So place a check mark in front of your name and then hit activate. And then activate. And then you just switch your view back to active connections for patient. And you can see that I am again back on the care team. I'm going to hit refresh because I'm not the lead, so let me just refresh my screen. So you would have to put yourself back manually as the lead if you're the lead for the patient or need to be the lead. And again, to do that, you would just click in the blue. Place a check mark on lead CC. Hit save and close. And then just refresh. And there you are listed as the lead again.
Thanks, Danielle. Remind me if we're covering how to enter a care team. I think they were asking for a care team conference.
Okay.
Are we covering that today, or can we add that to the end?
We can certainly add that, definitely.
Perfect.
Yep. The next one I was going to show is how to bulk add yourself to multiple care teams at a time. This is a little, there are some things you have to be aware of that you can only do one page at a time, which I'll show you what I mean by that. So I'm going to go home. Okay, I'm going to click on patients in the orange. So this is basically, I want to add myself to like 10 of these patients at once. For example, the trick is you can only do a page at a time. Like I could technically place a check mark here and add myself to all 50 of these people. There's one of 50 right here if you look there. For demonstration purposes, I'm just going to pick the first one, excuse me, and then I'm just going to pick the last one of this list. And then you might want to, if this would be anything you'd ever use, you would just want to maybe filter down your list to get it to 50 or less. Excuse me. Maybe that's by the care coordination level. You'd pick all your high risk people that have Medicaid. So you would filter your list down and try to get as many people at 50 or less, because you can't go to the second page. It won't work, but I'll just demonstrate what I'm going to do here. So I'm going to just add these two people. They're the first one and the 50th one. And then you just hit this assign care provider. And then you put your name in. So I'm going to put Palmer. And then you hit add. And pick your role and participation type. And then hit add. And it says your request has been submitted. It takes a few minutes to process, and you just hit OK here. And then you close the tab right here. Now I'll show you that I've been added to those two people. So you can click in to Edith Adams. Care coordination. And then here I am. I'm on Edith's care team now. Now the trick is with this functionality, you can't bulk add yourself as the lead. So you would still have to go in and make that additional step to add yourself as the lead if you wanted to. And to do that, you would go into the grid and then click in the blue space and check mark that lead CC box. And I'll show you, excuse me, that I went in and added myself to Kenneth Gilmore. Sorry, so I'm ahead of it. And there I am. I'm on his care team. And then you can place a check mark, like let's say you wanted to add yourself to all of these people. You just do this and check marks all of them, and then you do assign care provider. And you would add yourself to all 50 of those people. That's that demonstration. Were there any questions about that?
Nope.
Okay. Let's see. The next thing I was going to show is how to search for active Care Navigator users. This might be helpful. Well, it just gives you a quick snapshot of who's an active user in Care Navigator. So, and you can filter it down by your health service area. So let's see. So from your home screen, you can hover over Care Navigator. And what you're looking for is the CN user tab. So you just have to arrow over here and click CN users. And of course, this is the staging environment, so it looks like we don't, yours will be filled in all the health service areas, but this is a list of all the people who are active users in the Care Navigator system. So that'd be an easy place to go and to see if someone from your organization is part of the system or not. Okay, and then yeah, if you wanted to filter it, you could just turn your filter on and go ahead and filter by any of those categories. Okay, that was a quick one. I can go in and that was the ones I had planned out, but I'll go in and do the care team conference one. Demo.
Perfect. That would be perfect.
Okay, great. So I'm going to go to my Gail Matthews. So I'm just going to show you how to add a care team conference. So you just click on care team conference. And these are the ones that are currently entered for this patient. To click a new one or to add a new one, just click on this plus sign. And then visit type, you pick Care Team Conference. Patient family invited, you pick yes or no, pick yes. Attending, yes. And then you pick your encounter purposes. You would, excuse me, enter any notes about why you're having this conference. But as you can see here, it says please enter the following information. So you would provide the goals of the meeting, a brief summary of the meeting, and action items. So you would just list those out. I'm just gonna, for demonstration, I'm just testing user group call. And then it also gives you a character limit to tell you you have room for this many more characters. Okay, and then you would hit your save disk. There's a new feature which we haven't talked about yet because it's not in production, the Append Note, which we're currently working on. If you typed your note in, you see how it's locked now and you need to go in and append it, you can place a check mark here and type in a new note. Functionality, again, is we're in the process of getting it added. It should be in there, move to production probably in the next week. So we'll look for that.
And we'll communicate that out to folks because that was some feedback from the field of and many of you are reaching out to us and then we usually update a note for you or we'll delete out something and so the functionality will give a little bit more independence to folks if they want to be able to update or addend a note. And then we'll be showing it in the next, we'll probably create a module for it on our website and we'll also be showing it on our next user group call. And I have a couple questions, Danielle. I'll let you finish where you're at.
Yeah, no problem.
Are you in the middle of this and want to finish it first?
Yeah, yes, I can finish. I'm just going to add the attendees here. Okay. So to add the attendees, we're going to click on this grid. And then, excuse me, add attendees. And well, here they are. There's a lot of them. These are all the people that are on Gail's care team. So you just go ahead and pick the folks that are part of this conference. So we'll just, and then you hit submit. And then OK. And then to get back, I usually click on the patient's name here. And then to have them populate here, I mean, there's a couple ways to do it. One, I just right click with my mouse in this space and I hit refresh list and then it populates the two people that I just chose. And then you can see the status reason says in progress, and this is where you would just want to pick completed and then save. And then to get out, I would just, because it is its own window, I just click on this X box and here it is, the care team conference that I've just entered. Okay.
And Danielle, the question was, can you add the care team conference via the encounter log as well?
Well, there you can, yes, I guess the short answer is yes for that. So if you went to care team conference, oops, sorry, just do a new one here. you can pick when you go for your visit type. Sorry, you would just pick the top one instead, care management. And this is the encounter log. Or you can, oh, go ahead.
And then for the person who asked, can you speak to how often care team conferences should occur? That's really within the care coordination space, not the technical space that Danielle and I operate in. And so if you could private message me your contact information, I can put you in contact with the care coordination team. I'll also, if that's not a preference for you, I'll also give you the care coordination public email, and you can email them directly. That's all I've got, Danielle, so far.
Okay. I didn't have any more scheduled demos. I don't know if anyone wanted to see anything else, or I can bring it back to the PowerPoint for some reminders.
Let's leave it here. I got another question, and now we'll just kind of give folks a moment. If there's something that you would like to see within the system, as Danielle said, please take a moment to put it in the chat, and we'll bring it up for you. The last question that I received, Danielle, with regards to the Care Team Conference is, if you have a meeting with people not in Care Navigator, do you have to add them all, or can you put them in your note? For instance, episodic care, and you are reviewing with the care team in acute care. So from a workflow standpoint, if we're looking at this from a technical lens, which that's also a care coordination question, but from a technical lens, best practice would be to put them, assign them as part of the care team conference. There is impact from a payment lens for non-ACO members being on a care team conference that you might want to take into effect. But specifically kind of looking to get a little bit deeper into that question, I'll give you the care coordination public mailbox, or I think this was Sam, connect with me and I'd be happy to set up a direct connection so that you can talk through that a little bit further.
That's a great question.
And there's a couple more folks asked about timeline for how often care team conferences should occur. And I think that's, again, going back to our care coordination workflow. It's a question that if folks give me their names, or they can reach out directly to the care coordination inbox to be able to talk through that, that would be best practice. Some of the questions we can answer here, but we really try to keep to a technical lens so that we don't misinform anyone. And we have some really great individuals, Robin and Tracy, that many of you probably have talked to with our care coordination team that are more than willing to help navigate those questions. Got a couple of them. Is the care team conference scheduled using whatever media the lead CC chooses, i.e. phone calls, Zoom, etc.? Absolutely. I think we're most certainly in an environment now where phone calls in person is not always an option, especially given where we're at. But Zoom, so yes, a care team conference can be many different medias for what works best for the patient and those involved in the care team. Let me see. Just making sure I'm not missing anyone. Nothing has come in yet, Danielle, but whenever I say that,
One might pop in.
Sometimes they pop in. So we'll just give a couple more moments
Sure.
for folks if there are any lingering questions or desire to see any workflow within Care Navigator.
Mm-hmm.
I'm also going to publish the care coordination email for everyone, just so if that's more efficient for you guys to reach out directly, you have that option. Otherwise, I'm more than happy to facilitate getting you guys in contact with them. What is the care coordination task box and how does one access this option?
Okay. I'm not sure exactly where you're seeing that.
Task box.
Care coordination task box. Need a little more information maybe for that one.
We'll give that person a second to maybe give us a little more info. There's someone who's requesting to run a list specific to an organization. Happy to help you with that. Reach out and send me your email so that we can connect with you directly. We can most certainly help facilitate getting a list. And it sounds like it might be helpful just to have a phone call rather than go by email for that. If you accidentally hit complete instead of save when entering goals and tasks, is there a way to reactivate them?
Yeah, that's a common thing that can happen. Once it's completed, it's locked, so we can't open it back up. The only thing we can do, you can contact the help desk and we can delete it for you and you'd have to re-enter it.
And the reasoning for that, folks, is it is related to payment. And to ensure that our payment streams are accurate, we had to put some parameters in place to limit what we could edit in terms of goals.
Yeah.
But we do strive to have a really quick turnaround when you guys reach out for instances like that, because we know they're time sensitive. And so the help desk can be reached out, and we have that contact information that will go out in this slide deck if any of you don't have that already. Bear with me, Danielle. I'm just getting caught up here. Would you review what is required to update a care plan that was completed 24 months ago and the patient is continued to be care managed with new goals and tasks?
So, if I'm understanding right, I can show you how to enter a care plan with a goal and 2 tasks, but we can't go in to edit one that's currently in there.
And I think what that might be in relation to,
okay,
and I think Robin from our care coordination team can also speak to this if there's specific conversations that want to be had, Maureen, is each time, it's related to payment, and so I know the answer to it, but it's not within my scope, so I'm trying to navigate this clearly. But goals and tasks will warrant payment for up to 24 months. And so after that period of time, and typically we see that patients have, for their goals and tasks, there should be a start and end. And in showing progress, someone doesn't typically remain care managed for the same goal for over 2 years. And if they do, there's documentation that shows kind of what progress has been had. And so I think that, Maureen, that's what your question is with regard to. And so at that, if that's the case, then a new goal or a new goal should be entered with affiliated tasks. And if those goals are the same as the previous goals because they haven't been obtained, they should be re-entered for that patient, and clarifying information within the note can be provided to provide progress and updates on those goals and tasks, and that would warrant payment again for that patient. And if you would like some more in-depth conversation around that, our care coordination team can help, but I hope that that gives you some of the information you were looking for. And we're getting a couple more questions about the task box. Perhaps the task box and the email is one and the same. Please clarify. I think for the individual that had asked that question, we needed just a little bit more information. Okay. Danielle, I don't know if you've got anything more to offer. I don't on that.
I'm not positive. I don't know if they're talking about the tasks that are assigned to a goal or not.
That could be it. I haven't gotten a response from that person, but if you're here, give us a holler and maybe put your name in it. So because I have quite a few anonymous people and I want to make sure I'm getting your answers correctly addressed. Give it a couple more minutes, Danielle, so I can just weed out some of the questions here. And I got a question of how to reach the help desk with regards to technical questions. And we have that email. I'll send it through in the chat. I'll publish it for folks. It'll also be in the information that we send out from this email. It's pretty much everywhere. We have a question mark in Care Navigator as well. Danielle, I don't know if you'll want to show that if it loads.
It's loading right now.
Perfect, and I'll put it in the chat.
So I just clicked on the question mark, and here it is, our phone number and our email. And then you can click here to get to our resource page on our website. It's right here in the question mark.
And we also link to the modules, and we have quite a few video and written instruction modules that folks can watch, and we'll allude to those again in the PowerPoint that we send out to folks.
Yes.
I got through all of the questions so far.
Okay.
We had quite a few, so I just want to give folks a couple more minutes, and we have quite a few people still on the line, so speak out if you've got something. We'll give another minute or so, and then Danielle will bring up the PowerPoint and just show the tips and resource page. And then as people kind of think if they've got other questions, just a reminder that next week we'll send a follow-up email. This session is recorded, so if folks want to go back to a particular section, or if there are individuals within your organization that were unable to attend and have some interest in some of the demonstration, you guys can look through and you don't have to listen to the whole thing. You can scroll and pick a section, but that'll be available on our website next week. And in the interim, we send out a YouTube link so that you guys have access to it, I think by Tuesday of next week. And then it will be on our website. And we'll send out the PowerPoint, we'll send out any notes that came up. And for those of you that had specific care coordination questions, thank you for asking them. I put in an email to our care coordination team for a few of you, and they'll be in contact. And if I got your full email, I included you on that so that you guys can have a conversation back and forth. I think we're looking good. So let's move on to the PowerPoint. We'll just go through quickly the resources that are available.
Oh, I have to go back.
And the slide deck has notes. So Danielle pretty much has memorized because she's in the system every day. And so we have each slide in the PowerPoint gives some written information about what we covered in the demonstration.
Yes.
And then I think we typically have a resource slide as well. Is that correct, Danielle?
It's right here, the last two.
Perfect.
And they're What's the other one?
And that, again, just kind of connects you to our website, where we have different resources that are available. We're also, this is part of our job when we like what we do, so reach out to the help desk if you've got questions. The contact information is what Danielle had just brought up on the screen via the phone or email, and we're always happy to help. So thank you. We had a lot of great questions. Thanks for your patience and us answering those. And I hope everyone has a wonderful weekend with no snow, and we will be connecting back. Our next one is June, correct, Danielle?
Yes.
So in June, we will be doing another session, and that event will go out to you guys. And just keep in mind, you'll be getting an email or two from us coming up soon, because we'll have Medicaid 2021 data in the system, and I anticipate our commercial payers for Blue Cross Blue Shield and MVP will be soon to follow, and we'll be emailing as soon as we get it. We're all hoping to get it soon, so keep an eye out for that. And thank you everyone for your time.
Thank you, everyone.